So, a warm welcome and good afternoon to all the PhysioTV viewers. It is with great pride and immense joy that we would like to introduce our distinguished speaker, Dr. Chanan Goyal ma'am. She is a demonstrator at Government Physiotherapy College in Raipur and Director of Brain Child Pediatric Therapy Solutions in Raipur with a 10 years of clinical experience in dealing with children with special needs and more than 6 years of teaching experience. She presented at the APTA Combined Sections meeting held in 2023, chaired a session at the World Physiotherapy Congress in Dubai, which was held in 2023, and has presented three papers at World Physiotherapy Asia Congress in Bali, which was held in this year as well. She has also received multiple Best Paper and Poster awards at national conferences and was honored with the Outstanding Women Physio Award at Physio Manthan and IAPWC conference in 2023. A resource person for over 60 conferences and workshops which are held nationwide. She has 19 international publications, 14 as first author in PubMed and Scopus Index journals, and serves as an associate editor for Pan African Medical Journal. We welcome you, ma'am, and I will hand over the mic towards you. Thank you.
Thank you so much for the opportunity and for the kind words. So today the topic is virtual reality, which is a new frontier in pediatric physiotherapy. So here I'll first begin with the common pediatric conditions that we encounter as physiotherapists. The most common cause of locomotor disability in pediatric population is cerebral palsy. Another common genetic condition is Down syndrome, along with multiple other genetic syndromes. Next is autism spectrum disorder, which is on an all-time rise nowadays, and attention deficit hyperactivity disorder, ADHD. So these are conditions which usually benefit from therapy. So therapy is the mainstay of treatment, and usually for children who have cerebral palsy, they need lifelong management, and children also need age appropriate activities. And only the active participation of the child in therapy can give us the best results. So, how do we gain their active participation? The most necessary thing for gaining active participation is that the child must be motivated while the therapy is ongoing. A child has inherent motivation to play, and that must be tapped for therapeutic uses. So, play nowadays has different forms, as we all know. Apart from outdoor play, now we also have new, innovative, and novel, fun ways to gain compliance and to maximize the adherence to therapy. There are multiple games which involve augmented reality, virtual reality. So these games are also known as serious games because though the child is motivated to play, but it has serious therapeutic aim or goals. Gamification, exergaming, these are different terms which are used for such interventions. So exergaming is a term that combines exercise plus gaming and active gaming. So, this is a new, emerging, promising intervention that can be definitely used as an adjunct to conventional therapies. First, we talk about augmented reality. So, augmented reality in day to day life, we all are using the form of different filters that we use on Snapchat or while we are trying different clothes while online shopping in a virtual fitting room. So, how if we are buying furniture or if we are like trying anything new to buy, we can have a preview. So in augmented reality, there is a real environment on which some augmented picture is added. It is also used for indoor navigations, for range of motion estimations, and in different forms of games like we have Orbit uh, Earth, in which we have a game, Play Shifu, where if the augmented reality is playing a role, when the child places the device on the globe, the child gets to know the details about that place on the screen. So these are different uses of augmented realities and examples. Now we come to virtual reality systems. So virtual reality systems can be divided based on the level of immersion into three kinds: non-immersive, semi-immersive, and immersive. So non-immersive systems are those in which we have a screen and the child is sitting or standing in front of the screen. The webcam senses the movements of the child, and accordingly they play the game on the screen. So when the movement is sensed by the sensor on the system, on the screen which is there in front, the child the child's movement actually moves the avatar of their part on the screen, and this motivates the child to repeat the movements, and this voluntarily actively when they try to participate, this helps in improving their muscle function. So this is non immersive, in which they can see the real world, just there is a screen in which there is a virtual world which is interactive with their body movements. In semi immersive type, uh, they are into a room where the room looks like a virtual environment, but if but the child is also able to see the natural environment. If some person enters into that room, child will be able to see that person also, along with the virtual environment that has been created on the walls or on the ceilings. So this is semi immersive. And then there is totally immersive experience, in which the child is immersed into a virtual world with a head mounted display. And then the child is not able to see the real world. The child is totally immersed into the virtual environment, which may display, for example, as we can see here, if the child is in space, or the child may be underwater or in a forest or in a garden. So the child has a 360-degree view of that virtual environment in which the child plays the games. So why is the need for using augmented or virtual reality? So as we know, neuroplasticity is best, it is the maximum neuroplastic potential is there in the early years of life, and to tap that potential there should be sufficient repetition of movement which has to be learned, and sufficient number of repetition is possible when the child is given some goal directed activity in which the child is interested. And because augmented reality and virtual reality is entertaining, engaging, and is also easily applicable, this is one of the best emerging options that can be used for children who are not using their particular parts or limbs. Here we can see the child is kicking in real world, and the avatar is doing the same action in the virtual world on the screen. So this is how it works. Interaction with virtual environments help to catalyze the neuroplastic changes, and like we can see, children with different levels of gross motor function can play such games. A child who is able to stand, a child who has difficulty in ambulation or standing independently can play the games while the child has been seated, maybe on a wheelchair or some other seating in front of the screen. And the areas of improvement, which in which the previous studies have shown that uh, there is improvement in balance, gait, upper extremity function, eye hand coordination, visual perceptual skills, and functional independence in children who have been given these interventions. So we look at some recent research that shows the benefit of such games in children who have difficulty in their neuromuscular control. This types of games, they have shown that they mediate reciprocal inhibition, and then with the EMG biofeedback and augmented reality, child gets feedback to the about the movements, real time feedback, and accordingly the child can move the limbs. Here we can see an example. In the virtual world, the child has to hold the balloon and raise the arms and straighten the elbow and release it. So this, when the child does it in real life, the avatar does the same thing on the screen. And this motivates the child to do that action because the child gets that visual and auditory feedback from the screen. Similarly, in children with hemiplegic cerebral palsy, it has been observed that virtual reality training improves the symmetry between the two sides. So here we can see the initial position on the left side. The child has affected left side. The child has hemiplegia and the left side is affected. When the child tries to move both hands forward towards a target, here it is a bun, then the left hand is behind the right hand. Now the screen shows the avatar of the child's upper limbs, and then the child tries to bring the left hand forward to match up with the right hand while playing the game, and the feedback is on the screen. So this augmentation of feedback helps the child to give the best because they are quite motivated to reach the goal in their virtual environment. Here is another haptic aided VR setting. Haptic devices give haptic feedback, which means tactile feedback. So here the child has to pick and drop the coin in the piggy bank, which he or she can see on the screen. So they have to manipulate using their fine motor skills. Also, it has been seen that visual perceptual skills improve and visual motor integration, eye-hand coordination improves with these activities. Another study that used AR interactive game in children with cerebral palsy. So in this, an application was used that is freely available. It is known as Scratch, and here we can code multiple games according to the interest of the child. And how it works, we just need a laptop with this application downloaded, and then the child sits in front of the laptop, and we have already coded some games in the system. The webcam senses the movement, and then a particular uh, character appears on the screen which is of interest of the child. So the child repeats the movement so that he or she can see that particular character and hear that sound which the child likes. So here children who have even difficulty in standing can sit and do the movements. Another study shows that virtual reality, when combined with kinesiotaping, can result in smoother movements and better dexterities. Augmented reality and virtual reality is being also combined with therapeutic robotics, and motor learning principles is being used. Here we can see a device where the difficulty level of the game is changed according to the performance of the child. So The child can see the avatar on the screen, and when the child does the movement, if it is very very challenging for the child, the robotic device reduces the challenge. If it is easy for the child, the device increases the challenge in the virtual environment. Also, virtual reality is being combined with body weight support or partial body weight support with the harness treadmill training. Here, if the child is just made to walk with the harness on the treadmill, the child may not be able to sustain the interest for walking after a few minutes. So, if the child is given a virtual reality combination with this treadmill training, the child feels as if he or she is walking in a garden or at some different place, and the avatar walks while the child walks. This helps to continue the session for the desired period. So here is the summary of the intervention that has been used by previous studies. The duration varied between 30 to 45 minutes per session. The frequency varied between 2 to 3 times per week for 4 to 8 weeks. Various levels of motor function were used. So the gross motor function classification system varied between 1 to 4, and the manual ability classification system levels between 1 to 3 in children with cerebral palsy were included. And the control group underwent maybe traditional and conventional physiotherapy and occupational therapy. And the outcome measures, different outcome measures, which showed changes in various parameters, included gross motor function measure, that is GMFM, their motor proficiency, their hand function, the different tests like box and block test, able hands kids questionnaire, which is answered by the parents about day-to-day activities. VFM is functional independence measure for children. Pediatric balance scale, that is the pediatric version for book balance scale. These all outcome measures were used in the studies that showed improvement. Similarly, different gait parameters, spatial and temporal parameters of gait, 10-meter walk test, 2-minute walk test, and different tests of visual perception, playfulness, all these measures have shown changes, positive changes, and promising results after the use of virtual reality games. So, different types of devices are now available, and because the market is quite competitive, there is a wide range of items which are commercially available. So, ranging from a few thousands to a few lakhs, there is a wide range for such devices. These include Nintendo Wii, Connect, Xbox, Oculus Quest, HTC Vive, Samsung Gear, Leap, PlayStation. These are different commercially available VR devices. So here we can see how this works when a person is moving the hand in real life or real world. The avatar of that person's hand can be seen on the screen, and that hand can be seen manipulating a cube, and now the hand has thrown it away. So these are different types of virtual environments which can be used for playing games and for improving the movements of digits. Apart from the head mounted display, other device that is used with it nowadays is haptic gloves. Haptic gloves give tactile information also in the form of fine vibration or tactile input, uh, so that apart from visual and auditory feedback, there is also tactile feedback, which also fine tunes the motor output. Different types of interactive flows are being used in which the child can pop up the bubbles, move around, and if the child kicks the ball here, the ball will move, and the child aims to uh, goal, make the goal here. So these are interactive floors which are also being used apart from the screens. Robotic assisted grade training is also being used, in which a robotic device provides the just right support and the just right challenge along with virtual reality. So there are, apart from cerebral palsy, some genetic disorders also in which it has been used and changes have been noticed. So there was a rare case of trisomy 10p and terminal 14q deletion in which we used augmented reality. The child had hypotonia, joint laxity, generalized weakness, and she had difficulty in standing without support, and she used to keep moving the head. And later on, she could use bottom shuffling for moving indoors. And then, when it was a plateau and it was difficult for her to stand without support, we tried augmented reality in the form of Scratch 3.0. Here we devised, coded a game in which her particular character appeared and made a particular sound. So when the child moved the leg, the character appeared and made sound which she liked, because she didn't actually followed commands directly. We had to use some motivation that she liked. So we placed a laptop here, and then the webcam sensed the movement, and then she repeated those movements. Initially it was done without weight cuffs, later we added ankle weight cuffs, and then uh, that led to the repeated movements must have led to improvement in muscle strength, and that must have helped the child to gain more strength in lower limb, which helped the child to maintain standing with lesser and lesser support, and now the child is able to walk without support also. So we've seen when there is a plateau in the child's improvement and we add some novelty and some fun games like this, the child is more motivated to push even more. And also we had used virtual reality. First we tried it for typically developing child, and then for children with autism for improving their manual dexterity, and then for children with hemiparesis, and then for children with diplegia who had difficulty in using the thumb. Uh, so these children also started using their thumb and manipulating the remote control. This remote control also had the haptic feedback. So this is a driving simulation game in which the child uh, can see the avatar of his or her hand on the screen. And when the child drives the car, the child has to use both the thumbs. So when a child with hemiplegia who keeps a thumb inside the palm uh, and doesn't prefer to use the thumb in the plane perpendicular to the palm, so for playing this, the child was so much motivated that the child started using the thumb of the opposite, the affected side also, which the child didn't usually bring out of the fist. And then, apart from the audiovisual feedback, the child also had haptic feedback through the remote control. So while driving, if the car dashed somewhere or if the car, bumped into something, the child could feel the vibration, and that sensory input helped the child to change, to get the feedback that the child has to change the direction and move it accordingly. So here we provided audiovisual and haptic feedback, and what and the use of non-immersive virtual reality was made, and this was presented in American Physical Therapy Association's meeting also, and also this was presented in World Physiotherapy Congress in Dubai, and we found that virtual reality with haptic feedback was found to be effective in improving hand function and functional independence in children with hemiplegic cerebral palsy who were between 6 to 12 years of age. And we use 9-hole PET test and box and block test to measure their manual dexterity, and able hand kids questionnaire for gauging their function in day-to-day life, as well as functional independence measure was it was scored before and after the treatment for a particular duration, in which the child was given virtual reality gaming along with the conventional physiotherapy as an adjunct. And thus we concluded after this study that yes, the children were looking forward to the sessions, and the compliance was good, and they were highly motivated to use the affected extremity in these sessions. That was difficult in bringing out from them from the usual exercises that we do at um, our place. So that is it. And here are the references which we used for designing the study. Over a period of around 10 years, last decade, there has been many studies that are showing how virtual reality can be used in different areas. Uh, Many studies are there in adults, and now uh, the emerging role is also being used for children. So this is it from my side. Thank you so much.
Thank you so much, ma'am. I just wanted to ask few questions.
Yeah.
Uh, does this technique also improve head control in the cerebral palsy children or in any other spectrum, which is the
So it,
main area?
yeah, so head control is a good thing that can be, further studied, because if the child is interested in looking at something, the child will fix the gaze, and visual fixation and visual tracking can help in enhanced stability of the head also. So yes, that is a good area that can be further investigated.
Correct. Also, can this technique be used in several sensory disorders? Like some children do show sensory disorders in CP as well, or in ASD or ADHD spectrum. So,
Yeah.
how will it help in those populations?
So, in children who have difficulty in sitting at one place, this can help them to focus their attention for a particular period of time at one task without being deviated or moving around, as this also provides sensory inputs. And we all know that right sensory input can lead to correct, like
Mo-
desired adapted motor output. So definitely this intervention involves sensory systems, multiple sensory systems. This can be used for children who have sensory processing issues.
Yes. Thank you so much for sharing such a wonderful experience in AI because it is upcoming and very needful. So, on behalf of the entire Physio TV team, I'd like to express my vote of thanks. So, first of all, I'd like to express my vote of thanks to our esteemed chairperson, Mrs. Manisha Sangvi ma'am, for her invaluable guidance and support. We are also deeply grateful to our respected principal, sir, Dr. Apurva Shilpi, sir, for his constant motivation. And a special thank you for our distinguished speaker, Dr. Chanan Goyal ma'am, for sharing her vast experience and insights on the topic of AI-based systems. So last but not the least, I'd like to thank you all the Physio TV viewers. So thank you, ma'am, once again, and we look forward for our next session.
Thank you
Thank
so
you.
much for having me. Thank you to Sancheti Healthcare Academy, and thank you, Nupur, uh, for having me here. Thank you.